Welcome to the Pets Rule Show. I'm your host, Mr. Animal Lover. Thank you for joining me today. Emergency pet care, what to do when your dog or cat gets hurt. This entire week, we've been talking about illnesses and injuries, pet illnesses, pet injuries that we can take care at home in a way to save a few dollars. But remember, there are times where even home injuries that persist over 48 hours, 24 to 48 hours, depending what it is, it's going to require a veterinarian call. And disclaimer, always after every injury or illness, it's good to consult with a veterinarian. And remember, you can always do the telehealth. That's the telehealth where you can do it over the phone, save you a few dollars also. There's services like that now. And you can do it over the internet or over a Zoom call. But those options are available. And it saves you time and money from having to visit a brick and mortar veterinarian specialist or your local veterinarian. Okay, let's start with some laughter. Like always, we want to bring some joy to you, right? Me and Bob over here. Bob, how you doing? You okay? How you feeling today? So, the theme is taking care of home illnesses and injuries, pet home illnesses and injuries, all right? That's the theme. The dog who got a paper cut and needed a priest. He got a tiny cut on his ear from rough housing with the couch. I rushed in like I was on Grey's Anatomy, applied antiseptic, wrapped it gently. He howled like I amputated something, then gave me the silent treatment. He's fine, but I now have PTSD from gauze. The cat who played dead over a stubbed paw. She slipped off the window sill and landed weird. Laid there like a Victorian widow, paw in the air making dramatic eye contact. I panicked, checked her spine, whispered promises, Googled cat chiropractor. 10 minutes later, she was sprinting across the house, chasing dust. The dog who refused to be touched during triage. He limped in from the yard, holding up his paw. I reached out to inspect it. He pulled it back like I owed him money. Every time I touched it, he whined louder, then wagged his tail when I backed off. Apparently, he wanted sympathy, not solutions. The cat who attacked the first responder. She had a little swelling on her paw. I tried to inspect it with a flashlight and compassion. She bit the flashlight, clawed the towel, and escaped under the couch. She's not injured. I am. Emergency care rule number 1. Never approach a cat without a will and a helmet. The dog who diagnosed himself with a treat deficiency. He let out a whimper and refused to climb the stairs. I carried him up, massaged his legs, checked for swelling, Googled, can dogs sprain knees? Turns out he just wanted to be carried and also get a dental bone. He's playing me harder than a Netflix subscription. The cat who played possum in protest. She fell off a chair and froze. Didn't move for 5 minutes. I cried. She blinked once, then casually licked her paw and walked off like, that's what you get for laughing when I slip. She wasn't hurt. She was performing a guilt trap. I leave the best for last. The dog who hates the thermometer more than pain. Slight fever. Try taking his temperature the proper way. The thermometer became a chew toy. He screamed like a siren and ran circles around the kitchen. Ended with a crushed thermometer, shredded paper towel, and two therapy appointments. They're mine. All right. Thank you for listening to the animal comedy portion. I hope I livened you up with a smile. Emergency pet care, what to do when your dog or cat gets hurt. Recognizing injury signs. Rapid identification of warning signs is crucial for timely intervention. Train yourself to spot these red flags immediately. Obviously, bleeding. We can see bleeding from a mile away, right? You see blood gushing out, or you see a trail of red blood. External bleeding, look for obvious blood on fur, skin, or surroundings. Determine if it's a superficial scrape, slow oozing, or more serious spurting steady flow. Internal bleeding indicators, pale and bluish gums, rapid heart rate, weakness, collapse, abdominal swelling. Monitor gum color and capillary refill time. Press on gums, color should return within 1 to 2 seconds. Fractures and sprains, limping or non-weight bearing, sudden refusal to use a limp or obvious discomfort when bearing weight. Swelling or deformity, visible angulation lumps near joints or abnormal positioning. Pain indicators, vocalization, whining, yelping, flinching when touched, reluctance to move. Breathing distress, labored breathing, rapid shallow breaths, or open mouth breathing. In cats, especially, open mouth breathing is an emergency. Noisy respiration, wheezing, gurgling, or choking sounds. Cyanosis, blue tinge, gums or tongue, indicating low oxygen. Shock, early signs, relentlessness, anxiety, pacing, panting, tacky, slightly dry gums. Advanced signs are pale or white gums, weak, rapid pulse, cold extremities, rapid breathing, collapse, unresponsiveness. Poisonous symptoms, gastrointestinal signs, sudden vomiting, diarrhea, possibly with blood, excessive drooling. Neurological signs, tremors, seizures, disorientation, stumbling or collapse. Cardiovascular signs, rapid irregular heartbeat, pale gums, weakness. Other red flags, sudden onset drooling, foaming at mouth, unusual odor on breath, sudden behavior change. Other critical red flags, eye injuries, cloudiness, excessive tearing, squinting, visible foreign object, heart stroke and exhaustion, excessive panting, drooling, high body temperature, weakness, collapse, choking, pawing at mouth, gaggling, inability to vocalize, panic, neurological emergencies, sudden paralysis, seizures, severe disorientation. Actionable tip, keep a simple observation checklist near you, kit, or store it on your phone. In an emergency, run through it mentally. Gums, breathing, posture, responsive, rapid recognition can save precious minutes. All right, it's time for the HLCPets deal. Let's get to it now. I love these deals, right? On HLCPets, Heart Loving Care Pets, you can get everything when it comes to pet deals. You have, let's go all the way to the top, freeze-dried protein. That's Yum Wolf King Canine. You want to get any type of over-the-counter painkillers for your pets. Right here, King Canine. You know what? We should go there. Let's go there. July the 4th is around the corner. Order your CBD now to get in the time for the holidays. Sniff out savings, get 10% off into your email. So if you want CBD treatment, everything you could think of for your cat and your dog. They got targeted essentials for dogs and cats, nutrition, anxiety, joint support, fur and coat, and immunity. Complete wellness from nose to tail, all in one. There's a reason thousands of pets just like yours love our products. And they also have here real food. Discover Tucker's Gold 1,000 milligram of bliss. The King Palm, they have everything you could think of in terms of CBD for anxiety, pain, all here. That's King Canine. All right. Emergency pet care, what to do when your dog gets or cat gets hurt. Immediate first aid steps, very important, very critical. Once you identify an issue, follow clear, decisive steps to stabilize your pet before professional care. Ensure personal safety first. Injured pets may bite or scratch out of fear. Wear thick gloves or use a towel muzzle if safe. Approach calmly and slowly. Controlling bleeding. Apply direct pressure. Use a clean cloth or gauze over the wound. Maintain firm pressure for several minutes without peeking too often. Elevate if possible for limp wounds. Gently lift above heart level if it doesn't cause more pain. Bandaging. Once bleeding slows, wrap with gauze. Roll and secure with tape. Avoid cutting off circulation. Check distal warmth and color. Tourniquet caution. Only as last resort on a limp and with knowledge. Note time applied and seek immediate vet care. Stabilizing fractures or sprains. Immobilize the limp. Create a makeshift splint using rigid items. Rolled magazine stick padded with cloth. Secure gently above and below injury site. Avoid excessive tightness. Minimize movement. Encourage your pet to lie down. Use blankets or towels to support or reduce jostling during transport. Spinal injury suspicion. If you suspect neck, back trauma after a fall, avoid moving the pet. Call for professional assistance or use a flat board blanket to slide them correctly. Clearing airways and managing choking. Visual inspection. Carefully open the mouth if the pet is unconscious or unconscious-like. Look for obvious obstructions. Only remove objects if you can see and reach them easily without pushing deeper. Heimlich maneuver variations. Only if trained, inappropriate attempts can worsen the situation. If uncertain, transport immediately for professional help. Managing shock. Keep warm, wrap in a blanket, avoid overheating. Positioning. For many dogs and cats, lying flat with head slightly lower than body can help. Avoid elevating head if breathing distress. Reduce stress, speak softly, minimize handling. Monitor vitals, check gum color and pulse. If comfortable doing so, note breathing rate. This information is vital for the vet. Safe transport. Use a secure carrier or makeshift stretcher, a sturdy crate or a firm board. Large flat object with a blanket can serve as a stretcher. Secure the pet. Avoid jostling. Have an assistant help, guide, and support. A calm environment, keep lights low, minimize noise. Covering the pet with a blanket can reduce stress. Communication documentation, note details, time of injury, onset, what you observe, interventions done, record on your phone or on a paper. Call ahead if heading to a vet clinic or emergency pet hospital. Call en route to inform them you're coming with an injured pet. This speeds up care on arrival. One strong recommendation for you: take a pet first aid course or watch reputable tutorials to practice these steps ahead of time. Confidence in your actions reduces panic, stress on the animal, and stress on yourself. All right, all that was a mouthful, man. Wow. Let's do another pet deal. We got plenty of time. And for that, I am going to go to. Let's go to. That's right, Unconditional Hearts. Shop for your dog, for your cat, dog treats, diaper wraps, cat and flea tick, dog and flea tick, dog pads, grooming. Delectables. That's right, delicious delectables. And they have the chicken flavor, the lickable stew, squeezable, and the bisque. Let's hear this infomercial.
Hey, while you're there, grab more delectables. You know, that lickable cat treat.
Delicko what?
Delectables.
Delickables?
Delectables.
Delickable delectables.
Yes. Just hurry.
Must be delicious. Got it.
Delectables lickable treat. Deliciously delickable delectables.
All right, I have one more left. And I'm going to feed it to Bob. Bob, we're going to eat this. Come on. Be ready. And this is chicken flavor. Let's eat this, Bob. Today, I bought a towel. All right, Bob. We're going to do this. That is all of it. Come on. You could do it. Okay, you got all of it? You sure? All right. He got all of it. Today I have a towel. I learned my lesson yesterday. Good job, Bob. There you go. Look, there's no more. Oh, it's a little bit left. Don't waste it. That is all of it. All right. That was a nice dessert for you, Bob? I want to ensure that you come see me every day when I'm having my show. Good boy. Okay. Back to emergency pet care. What to do when your dog or cat gets hurt. All right. DIY emergency kit essentials. Assembling a kit in advance ensures you have indispensable tools on hand. Wound care supplies, sterile gauze pads, various sizes, non-stick sterile pads, roll gauge bandage wraps, adhesive tape, pet safe or medical, antiseptic solution wipes, chlorhexidine or providine, septic powder or cornstarch to slow minor bleeding, scissors with blunt ends or tweezers. Restraint and protection, soft muzzle or wide gauze strips to fashion a muzzle when needed, leash or harness extra, thick gloves, latex, rubber or work gloves, towel or small blanket for wrapping support. Tools and instruments, digital thermometer, rectal and lubricant, flashlight or headlamp for examining wounds or eyes, instant cold packs for sprains and swellings, eyedropper or syringe for administering fluids, medications, emergency contact list, vet clinics number 24/7, emergency pet hospital, and poison control. Medication, hydrogen peroxide, 3%, only vet directly induced vomiting, no correct dosage. Activated charcoal, vet guidance only. Saline solution for flushing wounds or eyes. Disposable gloves, multiple pairs. Blanket or emergency space. Notebook and pen to record observations, times, and actions. Phone charger, power blank, ensure your phone stays powered during emergency. All right, cost-effective sourcing tips. Repurpose human first aid items. Many gauze, tape, and antiseptics are interchangeable. Just keep them separate in your pet kit. Dollar stores or discount retailers. Gloves, scissors, tapes often available. Buy in bulk. Extra gauze, rolls, and tape can be stored long-term if kept dry. DIY containers. Use a durable plastic bin or backpack you already have. Group items in resealable bags. Community swaps. Some pet owners groups exchange or donate surplus supplies. Check expiration dates. Rotate kits contents periodically. Set a calendar reminder to review every 6 to 12 months. Organization. Label compartments or Ziploc bags so you can grab items quickly. Keep kit in an accessible, known location. Ensure all family members know where it is. Consider a portal version for travel. Smaller pouch with essentials. All right, when to escalate a pet emergency or illness. Before we get to that, it's time for pet breaking news. And for pet breaking news this entire week, the Humane Society, right? We've been talking about, very important to me, American Humane Society 15th Annual Hero Dog Awards. This is the Oscars for canines, right? We get to honor them. Lovely pets. And I am going to show you how you can vote. There's 5 different categories, right? You're going to go to the Humane Society website. So it's American Humane Hero Dog Awards. You can click that on any Google or any browser you have, internet browser. And you're going to celebrate ordinary dogs that do extraordinary things. Heroes come in all breeds. These are the categories: law enforcement and first responder dogs, service and guide hearing dogs, emerging hero and shelter dogs, therapy dogs, military dogs. These are the 5 categories you're going to vote. And what are the rules? Public voting from August 4th of 2025, September 15, 2025. Dogs can only be nominated in 1 category. Open to legal U.S. residents, 50 states and D.C., who are at least 18 years old. You must own the nominated dog will be authorized by the owner. All right, go on there. Let's celebrate them. 5 categories, and good luck placing your votes. We will definitely give you the winner by the end of the year. All right, let's do another pet deal. FXW, cool off or cuddle up to 15% off. Explore FXW in different scenarios: anywhere solution, indoor solution, campsite solution, yard solution. All-in-one solution for pet comfort, a safe and flexible play area. FXW, all-in-one solution. Thank you for watching Emergency Pet Care. What to do when your dog or cat gets hurt. And it's about that time. It's time for Mr. Animal Lover's 1 Minute Beef. My beef is with pet parents. If you're a pet lover, you have a dog or a cat, it is your responsibility to have a first aid pet kit. That's right. If you missed any of my shows this week, go onto YouTube, watch them. You can rewind. And I tell you almost on every show how to put together a budget-friendly pet first aid kit. You can always go to the dollar store and find a lot of the first aid kit supplies you're going to need to pack it together. Or you can simply go to Amazon.com and buy it. It's going to cost you about $20. This is a basic cat or dog emergency kit. Or, again, budget-friendly dollar store. You can go there. And I provided you with a list on this show and definitely on a previous show of this week. And just put it together, you know. But it's your responsibility. You never know when an emergency is going to happen to put together a pet first aid kit. All right, that's Mr. Animal Lover's 1 Minute Beef. Emergency Pet Care, what to do when your dog or cat gets hurt. Before we finish, when to escalate. Distinguish between manageable at-home issues and emergencies is vital. Err on the side of caution when in doubt. Immediate veterinary attention required. Uncontrollable bleeding, breathing difficulty, signs of shock, severe trauma, fractures with bone protrusion, eye emergency, seizures, heart stroke, poisoning with unknown or highly toxic substance, severe burns, large wounds, or deep punctures, neurological signs. Conditions often monitored at home with caution: minor scrapes or superficial wounds, mild limping without swelling or obvious deformity, occasional vomiting or diarrhea, minor ear irritations. Key decision factors: duration and progression, behavior changes, pain level, owner comfort level. All right? And that's it for today's show. Thank you for watching the Pets Rule Show. Remember to join me Monday through Friday, 7:30 to 8 p.m. I'm your host, Mr. Animal Lover. Support the Pets Rule Show. Like and subscribe. Visit HLCPets.com for pet deals. Send me your questions, comments, petsrule@HLCPets.com. You can also call me 9 p.m. to 11 p.m. Monday through Friday, 1-800-213-0988. You have questions, I have answers. $1.99 per minute fee. Snap, share, win, enter your best pet pictures and videos for a chance to win cash prizes. Email your pictures, videos to petsrule@HLCPets.com. Thank you for watching. Have a good night. I will see you next week with a new topic.